Welcome back to our final episode of One Clear Vision. I'm here with Dr. Sophia Capo of ABC Optometry and Vision Therapy. We've done a 12 video or an 11 video sprint.
So far.
This is our 12. And we're going to use this time today to sort of skate over-ish all of the things that you've covered in the past 11 videos and encourage any viewers, if there's something you want to dive deeper and go back into the past videos.
Yeah.
And or
So it's like key takeaways.
yeah, the most important thing is just contact you.
Absolutely.
So
Come on in. We're
approachable.
happy to meet you.
Absolutely. So welcome.
Thank
and
you.
I'm actually going to miss you in here.
I know. I'll have to come back.
Okay. So you are a children's vision specialist. So how are children's eye exams different from adult eye exams?
Yeah. So kids are not just small adults, right? This is something we've talked about this entire time. Kids are not just smaller version of adults. Their systems and the way their eyes work, the way they see, because they're still growing, everything about them is completely different. And so when we take that approach and we decide to do everything from the, level of the child, we end up with a completely different exam. So we're not just looking at how clearly your child can see. We can't ask a child, the difference between 1 or 2, because a lot of the times they're not reliable. So what we're doing is a lot of objective testing. So it involves the skill of the optometrist. I'm doing a ton of looking into the eye, telling the child what their glasses prescription is. And then we don't just look at prescriptions. We're looking at how the eyes are focusing, how they're working together as a team, how they're aligning, because all of those things impact a child at school, and they impact their learning, and they impact their development. So because it's not an adult who can just say, this is what's going on and it feels weird and it's different, we need to take everything from the bottom up, and we need to assess everything right from the beginning.
Well, even the letters you're asking me to tell you, I'm like, it's a C, but she doesn't know the alphabet yet.
Exactly.
So, yeah.
So we have to use a ton of different methods in order to get things done with kids, because we can't use the same methods we do in adults.
So again, for the parents out there, that we have optometrist, but we have pediatric optometrist. So
So it's kind of analogous to how we have, physiotherapy, and then we have, pediatric physiotherapy. Or we have family physicians who can see all different sorts of, they can see children, they can see adults, family physicians. But then when there's an issue, or when you want care that's a little bit more specialized, that's when you would go to a pediatrician. So in our world, in optometry, you don't need a referral to see a pediatric optometrist. Mm-hmm. So if you think that you want that extra special care for your child, the care that I believe every child deserves in their eye exam, then you can just book an appointment. You don't actually need to get a referral to come see us.
So, Dr. Capo, can you share with us some things that parents should pay attention to or watch for that are signs or signals that give us clues that there
might be something going on,
a vision problem?
So, squinting or closing one eye when they're trying to do something is a really big one, because sometimes children don't even realize that they're doing it, and then it's the parent or the teacher who notices that. Of course, if you see anything out of the ordinary, like an eye turning inward or outward, or if the child mysteriously says, I have double vision. But I'm going to say it's not very common that children complain of symptoms anyways. I've had children that, have really, really high prescriptions, and they come in to see me, and I just ask, how are your eyes doing? Do you see everything clearly? Do you ever see things blurry or fuzzy? And the kid's like, no, never. Parents say that, they play hockey really well, and they're succeeding at school. And then I'm like, you do not see very well at all. So a lot of the times it's really hard with kids to even pinpoint what a symptom might be, which is why these routine tests are really important, to just come in and say, is there something there that's wrong that my child is not telling me?
Mm-hmm. But I even think the one that you alluded to or even spoke of is that child that maybe isn't interested in reading or doesn't enjoy reading, that's actually a sign.
100%.
Yeah.
Because vision is not just seeing clearly. You can ask a child, do you see things clearly? And they might say yes, but that doesn't mean that they're having things
Well,
fluctuate.
define clearly.
And
Do they even know?
Do they even know?
Yeah.
But it's also, is it sometimes clear and sometimes blurry? Like, how do they answer that question? If we just ask, is it clear? They might say yes, but it's not always clear. It's just clear sometimes. Or they might see double, or they might get headaches when they read. So it can be clear, but it's straining, and it's a lot of work to do. So it's incredibly difficult. Yeah.
So we covered so much in the 11 video series so far from, and these are general terms.
Lay terms, that's okay.
Nearsighted, farsighted, lazy eye, eye turns. Can you sort of give us an overview?
The important tidbits of those things. So the really important thing to remember about farsightedness in children. Farsightedness means that you see better far away, but you work harder to see up close. Remember, in adults, farsightedness means you see far away, you don't see up close. But in kids, it just means that you have to work harder to see. And we know from the research that children who have to work harder to see tend to be slower readers. They tend to have poorer vocabulary. They tend to struggle more in school. And so sometimes those kids, because they're farsighted, they're seeing 20/20. In each eye, they don't have any symptoms, but they're working extra hard. So that's our key takeaway for farsightedness.
Yeah.
Nearsightedness is the same in adults and kids, meaning you see up close, you don't see things far away very well. Now, we already mentioned that kids tend to not tell us when they don't see very well. But more importantly, about nearsightedness, we actually have intervention to slow down the progression of nearsightedness now, and that's called myopia control. So if your child is nearsighted, and of course we can only do this during development while the child's eye is growing, we can actually do an intervention so that your child doesn't become a -4 or a -6 or a -9 and have all of these risks of retinal detachments and macular degeneration and all of these other issues. So again, it's super important to find this and to start fixing it when we're really young.
And again, it goes back to that gold standard of testing. So
Absolutely.
Just come in early and have the testing done so you get that benchmark, you get that.
For sure. And we know approximately where each child is supposed to be in their prescription. So if I see, a 3-year-old come in and they're not nearsighted, but they're looking like they're giving the signs of becoming nearsighted, we have that conversation already. And this is probably going to happen in the next few years. So we need to make sure that this is something that we keep monitoring.
So the big one for parents, big question, screen time. Does it impact the vision of the children?
Yeah, and we talked about that with Dr. Bedard, the pediatrician who came on, and we're saying, screens, when we're looking with our eyes, we're exerting our focusing system, and we're working really hard with our eyes, and that can cause some strain, especially for those kids who might have that farsightedness, that they're working extra hard to see up close. But screens, more importantly, especially if we're using screens instead of doing other things, is impacting our mental health, our physical health, our gross and fine motor skills, and all of those other things. So same thing with the nearsightedness. Spend more time outside. Spend more time away from screens. And we'll see the development of our children just get that much better.
So in sort of closing the children's eye exam section, what is your message to parents that feel that maybe an eye exam maybe isn't on the list of priorities or top on the priorities as it pertains to children that maybe aren't complaining about their vision? Yeah.
I think that the overall arcing message is the more that we can do, the more that we find early and can treat early, the better the situation. So even with a lazy eye, which different from an eye turn, but a lazy eye, a lot of the times you can't see. And a child won't complain of having any symptoms. So those types of things, if we find them earlier, we can actually manage them. But if we find them too late, we don't have a good treatment for them anymore. And that's a lifelong impact that we're letting slide. So my message would be, even if you think it's not important, let's look at this from a prevention standpoint, and let's be proactive rather than being reactive in our treatments. So instead of waiting for the child to have a severe problem or waiting for them to be, 3 grade levels behind in school, let's approach this from a standpoint of, I'm gonna assess this first and rule this out to make sure that I'm setting my child up for success in the future.
And I mean, Dr. Capo, I'm a sample size of 1. We brought Charlotte in, and I knew for sure you were going to tell me that my granddaughter had just spectacular
And she did.
eyesight. And she did, but there was an area of concern that now is on the radar, and we get to watch and make sure. So knowledge is power. So, okay, so coming into concussions and vision assessment. So you specialize in concussion assessment, not only for children, but also for adults. So can you explain how vision can affect
someone after a concussion?
Yeah.
So our eyes come out of our brain during development, right? So the eyes are very, very linked to every single part of the brain, every lobe of the brain. And so if someone gets a concussion, regardless of how they got that concussion, whether it be, a whiplash or an actual head hit, a slip and fall, a car accident, we can get visual symptoms because our eyes lose the ability to coordinate. Now, a lot of the times our eyes don't lose the ability to see. That would be a very, very severe accident that needed different attention.
Yeah.
But after a concussion, if my eyes are no longer working together as a team and no longer coordinating, what that means is I could have headaches, I could have double vision, I could have an intolerance now to working on screens or to being able to read.
Movement.
Really difficulty with light sensitivity, and difficulty with movement in my environment. And that all has to do with the way our eyes are sensing information and the way our eyes are coordinating with our brain to present that visual information. So in a concussion assessment, what we're doing is we're not looking at, the health of the eyes and the prescription like a general optometry. We're diving deeper, and we're looking at those other skills that might be contributing to those specific post-concussion symptoms.
So how does your approach in concussion therapy differ from other rehabilitation forms?
Yeah, so vision therapy is a new field.
Yeah.
So there's not a lot of very, very great high level evidence in this space yet. And what that means is, as an evidence-based provider, I need to keep on top of all the research, and I need to provide the care that is best for my patient with the information that I have right now. Mm-hmm. So that's treating patients with respect, recommending care that's the care that's needed and only what's necessary, and making sure that we're considering all the other therapies that these people have to do. Because there are all these different types of therapies after concussion. Many of them are very expensive. And so we need to assess, how much is this going to cost versus how much we think it's going to benefit you. And we need to be like very open with our patients. So I follow a very evidence-based practice. And I prescribe vision therapy in a very conservative yet impactful way.
So Dr. Capo, you're also you're not siloed. You work closely with other ophthalmologists and neurologists.
100%.
And why is that multidisciplinary approach so important for those concussion patients?
So the body consists of so many different moving parts, so many different puzzle pieces. And I recognize that I am a active expert in one very small subset of that area, right? So I am the vision rehab puzzle piece. But that person is a whole lot more than just the vision rehab portion. And sometimes, because the systems are so interconnected, my puzzle piece can then influence someone else's puzzle piece. And so we need to work together to make sure, are we treating this stuff in the correct order? Is this person, sometimes we get people in who they're so dizzy that they can't even do a lot of my testing. And I'm like, well, then you need to go see a vestibular person, or you need to go see an ENT, or you need to evaluate this from a different angle before we can then evaluate it from a vision standpoint. Or vice versa. Sometimes people, their eyes are actually causing the dizziness. And so we fix that, and then they can succeed better in their other treatments. So it's very important to work with all of the specialists ophthalmology, neurology, physiotherapy, kinesiology, counseling for the mental health component, and all those other professions to make sure that we're targeting this person as a whole and not just as our own individual puzzle piece.
So again, as it pertains to concussion rehabilitation, what progress have you seen in patients that have undergone the vision therapy?
So patients come to see me for vision therapy when they have specific vision symptoms. Now, the thing that we treat most often and the thing we have the most evidence saying that we can treat are symptoms of double vision, blurry vision, headache, intolerance to screens. So when those people come, a lot of the times with, 8 to 10 sessions of a very simple therapy, these people are feeling so much better. They're eliminating their symptoms. They're getting back to work. They're spending more time with their family without being completely exhausted after their day of work. So these are our life impacts. And we see people sometimes much too late, much later than I would want to see them, like 2, 3, 4 years after their accident. But that's why it's so important to tell everyone that these are things that we can fix. And if you come 4 years after, we can still fix them. That's okay if we're still struggling with them, but we can also fix them 6 months after,
earlier,
and 3 months after.
Yeah.
So
to try and help.
100%.
And again, that's getting back to that quality of life.
Absolutely.
Yeah. Okay. So low vision assessment. You are the only clinic providing low vision. And how does low vision rehabilitation work? And how does it help people? And again, especially in that senior community.
Yeah. So low vision is essentially a visual impairment that cannot be fixed with typical glasses or typical rehabilitation. So this is not someone who had an accident who then, we can rehabilitate through training. Completely a different section in low vision. So this is someone who likely has a health concern in the eyes. So like a macular degeneration or glaucoma, or other like genetic conditions that affect how well you can see on a cellular level. Now, what we do for these people is we're very function-based. So essentially it's, what do you want to do with your vision? And how can we make your day-to-day better, despite the fact that you have this visual impairment? So this is things like orientation and mobility training. So learning how to walk with a white cane, or giving someone a new piece of technology, like a speech-to-text, text-to-speech type of situation, or giving them handheld magnifiers and telescopes and things that we can mount on top of a pair of glasses that magnifies things more.
Like a knit.
Basically, like an extra little piece of something that we can do that is going to help that person's quality of life, not necessarily help their specific vision problem.
Makes perfect sense.
Yeah, and honestly, those are the majority of the time, the people who have those conditions are the senior population. So these are kind of a lot of the times age-related conditions of the eyes. And so we're seeing this in a lot of our elderly population. And these are the people who are already tending to be, socially isolated and having difficulty with their day-to-day tasks. And you add a visual impairment to that, and you can imagine how much that impacts them. Sometimes even just like we have really large playing cards, or like the same size playing cards, but instead of like having the pictures, it just has like a really big letter for the ace. And sometimes it's as simple as the only problem, like you're not cognitively, they're really able to do things. Like they want to go out and play, but they feel like they can't because they can't see the cards. And sometimes just switching the cards, hey, can you just ask your friends to play with these?
Yeah.
And it's a whole different world out there for them. So sometimes it's just that brainstorming as well. It's super fun for me because every patient who comes in has different things that they want to do. And then I get to sit there and say, okay, here's my toolbox with all the stuff that I have, but let's try and brainstorm some things together on how we can improve your quality of life. So it is really fun.
Dr. Capo, I have had the privilege of being on camera with you, but I've also been behind off screen with you, and it's been an absolute pleasure. You and your mom started a foundation. You were inspired. Can you tell us more about the foundation, what it is, who it serves?
Yeah,
why
absolutely.
You started it?
So we created a a nonprofit organization called We See BC Foundation. And this is a nonprofit, and we raise money to try and support vision services for people who can't afford them. So we had an episode here on the series where we talked about how much things cost, how much the government pays, and all of those types of things. And we know that the government provides a very small portion of coverage for a children's eye exam. Very little coverage for concussion assessments, very little coverage for low vision assessments. And so when we want to take all of these steps to do things properly, there's always a fee associated with it, so that we don't have to cut corners. Because if we cut corners, we're sacrificing the quality of the exam. But if we're not, then we need to charge more. And so what we're trying to do is create this foundation so that we can support these people who need them and bridge that gap. I call it seeing the difference. Seeing that difference in what the government covers and what people actually need. And so we are constantly looking for, ways that we can support our community, support the people in our community who need it most. We have programs at the office, for example, even right now going on that are like buy the frame and you get the lenses for free. Because we want to make sure that we have things that are accessible for every walk of life. And every person, struggling or not, we want you to be able to have the equipment that you need. The government provides zero in funding for children's eyeglasses. And so what we need is this program, this foundation where we can say, do you qualify? Like submit an application through the program. Do you qualify for this additional funding and this help so that you can get the services that you need? And we partner with doctors all over the province. It's not just here in Kelowna, because we want to have a big reach. We want to make sure that we're really getting to those people who need it. Because you can imagine, especially in the non-city areas, like in those more rural areas,
so underserviced.
It's incredibly underserviced, and things these days are very expensive. And we never want people saying, I can't bring my child for an exam, or I personally cannot come for a concussion vision assessment to help rehabilitate myself because I can't afford it. And right now, it is something in our community, even here, that happens every single day. This foundation came as a result of, our clinic, which was open for just over a year. And what we did was every time someone canceled an appointment or told us that they couldn't afford an appointment, we would put it on a list. Now, if that was a child, I would see a few of those per month as just kind of my own give back to the community. But if it was an adult who was waiting for a concussion assessment, it was very difficult because those concussion assessments usually always require treatment. And if we can't afford an assessment, we can't afford the treatment that needs to follow. And so this was something that came from deep in our hearts. My mom's a teacher, and we've been, in the children and helping children space for both of our entire lives. And so it was, we need to do something for the community. We need to make sure that these people are getting the services that they need, the glasses they need, the rehab that they need, so that we can help those vulnerable people.
So I do need to bring you in for another episode because we've covered all the past things in depth in other videos. I do want to bring you in again, Dr. Capo, if you will. I really want to talk about the foundation itself, its scope of work that it covers, and really put out a call for awareness, but
I would
for
love that.
Donations.
Yeah, thank you.
And see if we can't even match you to some local charities.
Thank you. Yeah, that would be awesome. We're always looking for anyone who wants to share, anyone who's been fortunate to have these services and be able to afford them, even to give one exam.
Yeah.
To say, okay, I want to donate one exam. And we've had a ton of people in the community already say to us, like, we want to donate an exam for a child because, back in the day, someone did it for us. And so we're constantly looking for donors and for people in the community to support their own local community. Because when we bind together, we are so much stronger together.
Absolutely. Dr. Capo, I can tell you I have absolutely enjoyed our sessions, and you're an amazing teacher.
Thank you.
And I thank you for fighting for and believing in the gold standard of care for all of the people that you serve at your clinic.
Thank you. This has been so much fun. And I never thought I would come on like a show and do something like this. But for anyone who's also thinking about doing this, it's so fun. And Nikki is also so fun. So come in and chat and tell your story, because that's how good things happen.
Get to ABC optometry and vision therapy just to get your assessments done.
Yeah.